Greetings everyone from my little corner of the world. Welcome back to the Geezer Zone. Thank you for making time to listen. It is great to be with you again. On this week's episode, we are going to continue our interview with Hugo Santana of A&A Financial Services. Our conversation will once again focus on Medicare. Before we go there, I have good news for all who are already receiving benefits from Social Security. Approximately 70 million Americans will see an 8.7%, that's 8.7% increase in their Social Security benefits and Supplemental Security Income known as SSI payments in 2023. The Cost of Living Adjustment, also known as COLA, notices will be mailed throughout the month of December to retirees, survivors and disability beneficiaries, SSI recipients, and representative payees. Want to know your benefit amounts before your notice arrives? The Social Security Administration says starting in early December, you will be able to securely view and save your Social Security COLA notices online via the Message Center in My Social Security. Make sure you're signed up for notifications from My Social Security Message Center simply by choosing email or text under Message Center preference. Benefit amounts will not be available before December without convenient access to your COLA notices by mail or online. You don't need to contact Social Security to get your new benefit amounts. It is beneficial, and I repeat, it is beneficial for you to sign up for My Social Security plan for the future, manage the present. So you got a plan for the future, manage the present. It is beneficial for you to sign up for My Social Security with a free account. Then you can receive personal estimates of future benefits based on your real earnings history. It is even easy to make a request to replace Social Security cards. Check the status of an application online and much, much more from anywhere. You can go to https://secure.ssa.gov to sign up for My Social Security to see your latest Social Security statement, to be able to determine how much more money you will receive in January. Let me repeat. Go to https://secure.ssa.gov to sign up for My Social Security, to see your latest Social Security statement, to be able to determine how much more money you will receive in January. On our last podcast, our guest, Hugo Santana of A&A Financial Services, was giving us some insight about Medicare. Let's get back to that conversation and pick up where we left off. Just
Really
a basic supplemental plan, basically what it covers is what Medicare Part B doesn't cover to a certain degree.
Yeah, so
right?
it'll cover the 20%. There is deductibles and there is a premium. Really the main one is the premium on that part. And there is a deductible for Part A and there's a deductible for Part B. I know the Part A, I'm not really sure about that one, but I can look that one up. And if you have any questions, I can answer those questions. But on the Part B, I think it's $203 a year that you have to pay up front at the first year on that part. There is some deductibles. It does not have the added benefits, the dental, the vision, the hearing, that is not in the supplemental plan.
And those are in the Medicare Advantage plan?
Those are in the Medicare Advantage plans.
And how far do these plans go with dental plans, for example?
How far as in how?
How much do they cover?
Well, every plan has a different amount of plans. We can only elaborate only on so much on those dental plans. So it does cover, what it covers is your dentals, your dentures, your cleanings, all that. It does cover most of the basics plus much more added on that part, on the coverage.
And if you didn't have a Medicare Advantage plan, you would have to buy insurance for dental apart from that. You would have to buy insurance for the drugs apart from that. You would have to buy insurance for your vision in that regard also, right?
Exactly. You'd have to buy all those extra added uh, to your supplemental plan. Besides the supplemental premium, you'd be buying dental, vision, hearing, supplemental insurance that are can be costly after a while.
One of the things that we wanted to do at this particular point was because October is very important
Yes.
for people that are on Medicare. Why is it that it's such an important month?
So October is the most important month practically, which is November. It's October the 15th to December the 7th is open enrollment. Open enrollment means that you can enroll into plans, switch plans, look into the 2023 plans that are going to be offered. What are the benefits for those plans? So those are very, very important dates. So this is very good.
So they sign up or change right now during the early enrollment plan, right?
Okay. Yes. On the sign up and if you sign up October the 15th or do a modification to your plan, somehow move to another plan or do something like that, it's October the 15th to December the 7th. It's in effect January the 1st. So you be effective January the 1st on these plans.
But that doesn't necessarily mean you're going to be married to that plan forever and ever.
Oh no. That doesn't necessarily. There is called OEP plans, OEP special election periods. There's different types of special enrollment periods.
In your experience, have you seen that people sign up with a plan and stay with that plan forever? Or
Oh yes. I've seen some of my clients that are just happy with the plan. They don't want to move. They're satisfied where they're at. They don't. They just stay with what they have right now.
Okay. And but even if you select something during that October through November, December period, and you get, let's say, buyer's remorse, you can say, you know what, Hugo, I want to change back or find me something better in January, right?
In January, there is a special election period that we can do, but it depends on the client on that part. So we can look into that when we get there.
Okay. The next part is the part of other services that an agent or a broker like yourself offers that we don't think about, that a lot of the people out there are not necessarily aware. Let's start with long-term care.
Okay.
Most people think, oh, I've got Medicare, it's going to take care of me, or this, that, or the other. That's not necessarily the case, is it?
No, it's not necessarily the case. Depending on the insurance, the sum of your benefits. If you look into your sum of your benefits of the plans of every different plan that there's some out there that have different types of dates that will, long-term care doesn't cover. You know what I mean? There's sometimes 100 days. You're talking about 20 days. You're talking about some other days.
Yeah, but I mean, if they need more than 100 days, they're going to need something else, or
They
how
are
are they
gonna-
going to pay for that?
They are going to need something else. So this is where we come in, and we offer all those benefits too. You can come by my office, call me, call the number I'm going to provide, 956-516-3630, and we can look into all those benefits, all those added benefits for your long-term care. Care on that part. You never know.
Because we never know what could happen. I mean, you could have a situation a stroke, for example, or Alzheimer's that develops something like that, and your loved ones can't take care of you anymore, and you have to go somewhere because they can't provide that service at home. So that's where something like a long-term care insurance comes into play, right?
Exactly. That's where the long-term care comes into play. Again, we really need to look into the long-term care products. A lot of people think that we're never going to get there, we're never going to do it, but it's really good to look into it.
And it's good to be prepared.
Exactly.
Okay.
It's like one of my friends, insurance agent, told me insurance was made for the future. Everything you buy iPhone insurance, or you buy phone insurance for in case it breaks. You buy life insurance in case you die. You buy car insurance in case you have an accident. You buy house insurance in case the house gets on fire. Insurance is not a now thing. It is a future type of investment that we're trying to predict our future. We never can tell what's going to happen in the future. So that's what insurance is. The whole definition of insurance. To me, that's what that happens. Funeral plans that we offer also, it's for a future time of our life.
Medicare open enrollment for 2023 began October 15th and ends on December 7th, 2022. During this time, people eligible for Medicare can compare 2023 coverage options between original Medicare and Medicare Advantage and Part D prescription drug plans, according to the news released by the CMS Newsroom. As we mentioned earlier, Medicare Part B covers physician services, outpatient hospital services, certain home health services, durable medical equipment, and certain other medical and health services not covered by Medicare Part A. Today, we also have additional good news on the cost of your Medicare premiums for 2023. The Centers for Medicare and Medicaid Services, known as CMS, in a news release points out that each year the Medicare Part B premium deductible and coinsurance rates are determined according to the Social Security Act. The standard monthly premium for Medicare Part B enrollees will be $164.90. That's $164.90 for 2023, a decrease of $5.20 from the $170.10 in 2022. The annual deductible for all Medicare Part B beneficiaries is $226 in 2023, a decrease of $7 from the annual deductible of $233 in 2022. These changes in cost will hopefully help all Medicare recipients on a fixed income fight the rising inflation rate. That's going to do it for us this week on our podcast, The Geezer Zone. Thank you for joining us today. See you soon, and remember, getting old is a privilege not everyone gets to enjoy. So let's make getting old fun. It's better than the alternative.